Hello, this is Dr. Stanley Lang. Welcome to this presentation, which is on basically three subjects: gestational diabetes, prediabetes, and autism prevention. So the reason I'm sharing on this subject is because one of the patients that I saw recently this week is somebody that is pregnant and is in a currently prediabetes state. So we know this because she had a fasting blood sugar that was elevated earlier before she got pregnant, and she was in to see me because she was seeking dietary counsel. And so I wanted to give some perspective both to her and to you about the value of the strategy that I'm going to outline for you. So gestational diabetes means that this is diabetes that develops during pregnancy for those of you that have not heard of the term before. And it's actually defined a little bit differently than diabetes for people that are not pregnant, women in particular that are not pregnant. But the point is that it's still blood sugars that are too high, and they are high enough to be pathological in a lot of different ways. Excuse me. Well, one of the things that is not appreciated is that gestational diabetes actually is a risk for autism. And this has been shown by recent research. This is not surprising because just about any kind of disruption of the intrauterine environment seems to be a significant risk for autism. And in a time when we're seeing an explosion of rates of autism, and obviously there are multiple other factors. I'm not suggesting that gestational diabetes is the cause of autism, just that it is one of the things that is a risk factor for autism. So when we know that we've got something that we can control, it becomes even more urgent when we know that it's linked to autism. So what is prediabetes? Well, prediabetes basically is kind of a no man's land or no woman's land between normal and the formal definition of diabetes. Now, the formal definition of diabetes in a non-pregnant patient is a little bit different than in a pregnant patient. And again, I'm not going to get into specific numbers, but there's a wide range of numbers that are above what we consider normal, but they're not quite enough to call diabetes yet. Now, we know from other research that prediabetes is still a significant risk factor for all sorts of things. In non-diabetic patients, it's a risk factor for Alzheimer's disease. It's a risk factor for heart disease. So it's not something trivial, yet it's still not in the same range as causing lots of the problems that formal diabetes does. So when I talked to this patient about what to do, it was clear that she was doing what many people do who have prediabetes or are actually diabetic, and she was eating too many high glycemic carbs. That's basically the American diet, and that's one of the reasons why I have taught a low glycemic diet strategy for the last 20 plus years. Now, this approach that I recommend is something that is completely safe in pregnancy. It is a low glycemic diet that works really well in pregnancy. And one of the things that you want to do if you have prediabetes is start eating a diet that's low glycemic so that you don't progress to gestational diabetes. Now, if you have gestational diabetes, the dietary strategy that I outline is way more effective than the usual diabetic diet in terms of reversing diabetes. So I encourage this approach because it's safe, it's healthy for both mom and babe, and it helps to prevent progression to gestational diabetes if you have prediabetes. So who's prediabetic? Well, without even checking your blood sugar, if you're significantly overweight, you're pre-diabetic already. And so taking action if you're contemplating pregnancy or are in early pregnancy, using a low glycemic eating strategy is a really wise decision because your odds of becoming diabetic are a lot higher than somebody who is not in that situation of prediabetes. And one of the benefits, besides having a moderate weight gain during pregnancy, is a lower risk of autism for your baby, which is a huge benefit. Now, without going into all the details of what is low glycemic eating, I just want to say that it's not hard to do. And I'd like to give you a free ebook that teaches you how to consume a low glycemic eating plan very simply. And this is an ebook that's called "Why Am I Still Fat?", which you can get by clicking on the link below this video or on the video. And depending on where you're seeing this, there's also going to be a link to a long interview that I have with somebody who's followed this exact strategy during her entire pregnancy, and you can hear what happened to this person and compared to prior pregnancies. And so if you're interested in what low glycemic eating is all about, I encourage you to get the ebook. If you would like to watch the interview, there should be a link on this video towards the end of it, depending on where you're viewing the video. So in summary, if you're pregnant or contemplating pregnancy, avoiding diabetes is something that you want to really work at, because there's lots of downstream benefits to you, but also clearly to the baby, because you decrease the risk of autism when you normalize blood sugars, especially when they're normal from the very beginning. So the overall approach that I'm using in this and all of my wellness strategies is an approach called whole person health. That means health of body, mind, and spirit. Making lifestyle changes is never simple when we're used to doing something a different way. So I believe that when we approach things by bringing in our physical, emotional, and spiritual resources, we have a lot better chance of being successful. And I encourage you, if you're considering making some dietary changes, to use a whole person health approach. Now, if you're not pregnant at this point, or you're not contemplating pregnancy, you might know somebody who is, and I encourage you to forward this video to that person, because they may find this to be very useful information and could be life-altering for not only the mom, but for the baby. I wish you well, God bless, and have a great day.